Today we're going to continue our lecture on drug calculations for pediatrics, and this time around we'll be shifting ground to a new method that we can use to calculate drug dose. So today's lecture will be focusing on drug dose calculation according to body weight. Now, of course, for those of us who are familiar with the hospital setting or with prescription generally, you will notice that some drugs are dosed, especially for pediatric patients. Their drugs are dosed according to their body weight. For instance, you will see in the patient's prescription or in the child's prescription sheet, you will see something like this. Let's say 3 milligrams per kg. Sometimes you see per day. So this is how you will see the prescription. This is how you see the prescription. So what does this mean? Of course, if you are familiar with this, it's a very, very easy method. Very easy method to get the dose that you administer to the child. So as a nurse, for instance, you will need to know how to calculate a drug dose that is written or prescribed or dosed in this format. But it's very simple. It's very simple. So we're going to be explaining the step-by-step approach or way to go about calculating drugs that are dosed in this format. Now, sometimes, especially some anti-cancer drugs are also dosed like this, but in that case, it does not come as kilogram. It comes as, let's say, 3 milligrams per meter square per day, or it can be per week depending on the drug. So it's something that you cannot do without as a nurse who is charged with the responsibility of administering drugs. So that is to say, you need to have a sound understanding of how to calculate drugs that are dosed according to either the body weight of the child or according to the body surface area of the child. Now let's quickly take one or two examples. And of course, still on calculations, we cannot do without formulas. Now, the essence of these formulas is to make things easier for us. But to get to a stage, if you are conversant with these calculations, you don't need some of these formulas to get to that level. But of course, at the learning phase, you need to get used to these formulas. And once you have mastery of the formulas, you can do it without necessarily using the formulas. But of course, for now, it's very, very good to know the formulas and all of that. So quickly, let's take some examples. Now, sometimes also, some drugs will be dosed just as I've mentioned earlier. Let's use 3 milligrams. It will be dosed, for instance, 3 milligrams per kg, right? Maybe in 2 divided doses or in 3 divided doses. Sometimes it can be like this. So it will be ordered in this format: 3 milligrams per kg, maybe in what? 2 divided doses. In 2 divided doses. Sometimes it can be 3 divided doses. Sometimes it will just be per day. So all of these examples we are going to also be looking at them. Now let's start with the first example. Let's assume a drug amoxicillin was ordered at the dose of, let's say, 20 milligrams per kg per day. So this is what the prescription sheet is saying, that you should administer amoxicillin at this dose. Now this is very, very easy, because the only thing you need to get with this type of prescription or dosing is the weight of the child. Now once you have the weight of the child, I think you are good to go. Good to go in the sense that this is per day, meaning you are not going to repeat it in that day. Once you give that first dose of that day, that is all. There is no need for you to repeat it again. Now, there is a formula we can use to get drugs that are dosed in this format, meaning drugs that are dosed in per day. So that is, the formula is dose per day. Dose per day is given to be dose per kilogram or kg multiply by weight. Of course, this weight is the weight of the patient also in kilograms or kg. So this is the formula you can use to calculate the dose of a drug that have been ordered or prescribed in this format. For instance, amoxicillin is ordered at this rate or this dose, 20 milligrams per kg per day. So you can comfortably use this formula to get the amount you are going to give for that patient for that whole day without needing to repeat the dose a second time in that same day. Now, this is the order. So what does this mean? So dose per day, let me shorten it as dose per day, something like this. So this will be dose per kilogram. Now you can see, this is what the dosing says or precision says, 20 milligrams per kg. So our dose per kg will now be what? 20 milligrams per what kg. So this 20 milligram stands in for dose per kg. So dose per kg is now 20. It's now 20. Then multiply by the weight. Now, the weight of the child is not given here, right? It's not given because in the procedure, the weight will not be given to you. So it's now left for you as the nurse on duty or in charge of the patient to gladly take your patient and weigh the child. Now, once you weigh the child, whatever weight you have or you obtain from the weighing scale is what you use as the weight of the child in kg. Now, let's assume a weight. Let's say the child weighs 15 kg. So after weighing the child's weight is 15 kg. So if the child is weighing 15 kg, so that means my weight in kg is going to be 15. So my weight in kg is going to be 15. So that means my dose per day is now going to be 20 multiplied by 15. This will give me 300 milligram per what? Per day. So that means the dose of amoxicillin I'm going to administer to a child whose weight is 15 and the drug was dosed or prescribed at the dose of 20 milligrams per kg per day. I'll be administering 300 milligrams per day to this child. I don't need to repeat the drug. So I don't need to repeat that dose. That is all for that day, right? So it can be in the morning, it can be in the afternoon, it can be at night, depending on the time you commenced the drug. If you commence it in the morning, preferably let it be at that same time every morning. If you started the administration in the afternoon, let it be at that same time on every other day. So that shouldn't be missed. Because these antibiotics, of course, they are prone to resistance. So you have to be very, very careful with the timing that you are going to use to administer. Now, this is one phase. This is one phase. This is a situation where the drug is dosed per day. So what if the drug is being ordered in divided doses? Now, what we mean by divided doses is you should administer the drug maybe twice in a day. Twice a day means an interval of 12 hours, right? Now, also, we can also use or utilize another formula that will aid us. Ordinarily, as I've said earlier, it will get to a stage where you have mastered this method of calculating drug dose. You don't need the formulas, right? But of course, for now, with time, you will get used to it and you don't need to use formula. Now, what if the order is to be administered, let's remove this day and put something like this. Let's say the order continues like this. That this same drug, we're using this same drug as an example. Let's assume it continues by saying in 2 divided doses. In 2 divided doses. So if it is dosed like this in 2 divided doses, that means I'm going to get a drug, right? That I'll be administering this drug twice in 24 hours to that child. So if I'm going to administer it twice in 24 hours, remember let's use the same example and also keep this value. We're going to still use them for the next phase. Now, we have seen dose per day. Now, dose are for in divided dose form. You can use this formula that says single dose, right? Single dose is given to be dose per day over number of doses. Number of doses. Very simple. Very simple. Now, single dose, meaning if I have a single dose, right, then I can make it twice. I can make it twice. That means the first dose in the morning and of course the other dose after 12 hours. So 12 hours interval for two divided doses. So if I have something like this in two divided doses, I can use this formula to get the single dose. Once I obtain the single dose, I can now use this single dose to get the what? The dose I'll be given subsequently. Now, single dose now can be calculated using this formula. Dose per day over number of doses. Now let's quickly use this same dose. Now already we have calculated previously that dose per day that we calculated earlier on, we got 300 milligrams, right, per day. So that means our dose per day will be 300. And what is the number of doses that have been included in the prescription? It says in two divided doses. So the number of doses now will be 2. Now be what? 2. Number of doses will be 2. So if you divide 300 by 2, you are going to have 150 milligram. So every time I'm going to administer this drug, right, I'll be administering 150, the first administration, then the subsequent one in that same day will also be 150. So that means I'm going to give it twice. So let's assume is, of course, is twice in two divided doses. It's going to be 2 times a day. So it's going to be 150 milligram, let's say 0 hour, right? Then the next 12 hours later, I'll also give 150. So this is a whole day. Or let's say, let's make it more simpler. Let's assume I started this dose, this first dose, around 6 a.m. 6 a.m. today. The next dose, let's say 6 a.m. I'm going to administer 150 milligram of this amoxicillin. Then by 6 p.m., which is the second dose, I'll also administer 150 milligrams. So that is altogether you have 300 milligram per what? Per that day. Per that day. So that means the single dose I'm going to that will be administering the first time, let's say 6 a.m. I'm starting the drug at 6 a.m. I'm going to administer 150 milligram. Then the second administration, which is going to be 6 p.m., right, is going to be also be 150. Then if you sum it for that day, you're going to have 300 milligrams. So this is how to go about calculations involving dose per day and also in divided doses. So if it is dosed 3 times per day or 3 divided doses, of course 3 divided doses is usually interval of about 8 hours, right? Maybe I'm giving a drug by maybe the prescription says 220 milligrams per kg in 3 divided doses. So here you use 3 here. Whatever you have will now be the dose, single dose, and of course you share it according to the hours. So it's going to be every 8 hours you'll be administering whatever you have if it were to be 3 divided doses. So this is how to go about drugs that are prescribed according to body weight. Now, a very common drugs that are prescribed this way, that is most of our anti-malaria drugs, especially the injections, they are prescribed according to the body weight of the child. For instance, it's very common. Alpha beta, that is alpha beta theta, is usually prescribed at 3 milligrams per kg per day. This is the prescription for alpha beta. So if you have something like this, you tell me your answer in the comment section. Tell me your answer in the comment section. So I'll leave it for you to calculate. Now let's assume a child. I will give you a way that you're going to use to do this calculation. Now let's assume I have a child or a child that is suffering from malaria. We have done all the investigations, and of course it shows positive for malaria, and we are using alpha beta theta, and this is the dose. The drug is dosed in this. So meaning at alpha beta theta at 3 milligrams per kg per day. So what does it mean? That means all I need to get here is to get the weight of the child. And once I get the weight of the child, you can apply those formulas or the formula that we have used to get the dose for amoxicillin. You can use that formula to get the dose for your alpha beta. And the good thing here is just per day and not in 2 or 3 divided doses. So now, take the weight of this child to be, let's say the child weighs 20 kg. 20 kilograms. So this is the weight of the child. So solve it and leave your answer in the comment section. I'm going to comment on those that got it right. So use the same example that we have utilized previously to calculate the dose of alpha, beta, theta at the dose of 3 milligrams per kg per day that you will administer to a child whose weight is 20 kilograms. 20 kilograms. So this is exercise number 1. And let's take another one. Let's say ceftriaxone. A child, an order, let's say order was given for ceftriaxone, an antibacterial agent, ceftriaxone, at a dose of 50 milligrams per kg in what? In 2 divided doses. In 2 divided doses. Take the child's weight to be 30 kg. Take the child's weight to be 30 kg. So you have an information like this. So this is still an exercise. And an order was given like this. That is, a drug was prescribed like this. And the drug is ceftriaxone. Injection was prescribed at the dose of 50 milligrams per kg. But this time around in 2 divided doses. So what will be the dose per administration? And the weight of the child is given to be 30 kilograms. So use the first example that we have shown to do the calculation. Now, the next aspect I want to also look at is still drug calculation based on the child's. This time around, we are going to shift ground from the child's weight to the child's body surface area. Of course, we can also use body surface area to calculate drug dose. We can use to calculate drug dose. Now, and most of the drugs that are administered using body surface area are mostly anti-cancer agents, some antiviral drugs, and also some corticosteroids can also be administered using the body surface area. Now, just as we have learned for the dose per kg, it's also in the same format. This time around, anywhere you see kilograms, it will be replaced by meter square, right? It will be replaced by meter square. That is the unit for body surface area. Now, let's assume this is how you see. Let's say dose per day is going to be dose per meter square, right? Dose per meter square multiplied by what? Multiplied by the body surface area. So this is what you have. So dose per day for a drug that is prescribed using the body surface area. This is the formula: dose per meter square multiplied by body surface area. Now let's assume this is how the drug will be dosed. Let's say which drug? Let's say, let's pick any drug. So let's say cyclophosphamide. Let's say cyclophosphamide, right? Has been prescribed at this dose, 400 milligrams per what? Meter square. So if cyclophosphamide is prescribed using this format, so what does that mean? So it means I'm going to administer this drug. Now, for you to see meter square as against kilogram that we are used to, this is to tell you that this drug is going to be administered using the body surface area of the child. This This is very important. So it's going to be according to the body surface area. So that means before I apply this formula, right, I will need to first of all calculate the body surface area. I will need to calculate the body surface area. Now, how do I go about it? Now, this drug has been given that we should administer cyclophosphamide at the rate of 400 milligrams per kg per day, at the dose of 400 milligrams per meter square per day. Now, what do we do? If we want to use this formula, the formula says dose per meter square. So this is going to be our dose per meter square. That is 400 milligrams per meter square. So this is our dose per what? Meter square. But of course, multiply by what? Body surface area. And we don't have this body surface area. Now let's assume we are dealing with a child that weighs 20 kilograms and height of the child is, this is weight. Let's say the height of the child is 90 cm. That is 90 centimeters. Now, let's assume this is the dose of cyclophosphamide that has been prescribed at the dose of 400 milligrams per meter square per day. So this is an anti-cancer drug. And the prescription, instead of per kg, which is what we are used to with regards to weight, this time around you are seeing meter square. So any prescription that you are seeing meter square is indicating that drug is going to be dosed using the body surface. It's going to be administered using the body surface of the child. And if you use this formula that says dose per meter square, right, multiply by what? Body surface area, you can now get the dose per what day. And look at the prescription. It says 400 milligrams per meter square per day. Now, further, if you see something like this time around, you're not just going to weigh the child alone and input the value of the weight into the equation. No, you have to also do another thing. What do you do? Since it's in body surface area format, you also need to get the height of the patient. Now, this will take us to another step because we need to calculate this body surface area before we can apply this formula, right? Before we can apply this formula, we need to calculate this body surface area. So now, let us use this information to calculate the body surface area of this child. Remember, if you can remember in our last lecture, I think, that is where we did the calculation that involves body surface area, how to calculate the child's dose using body surface area. And I said we have an equation we call the Monstellar equations. We have two equations. One has connection with the weight in kilogram and the height in centimeter, all squared over 3,600, and the other one is 31, and the height is in inches and the weight is in pounds in the second Monstellar equation. So now, since the weight is given to us in kilograms and the height is in centimeters, so that means the most appropriate Monstellar equation is going to be the first Monstellar equation. Now, let's use the first Monstellar equation. I'm going to, okay, let's find a way. Now, let's assume we want to calculate body surface area now using Monstellar equation. Remember, this is the equation, right? The height, I'll shorten it. You can go back to the video to watch how to go about the calculation. We said height is going to be in centimeter multiplied by the weight will be in what? In kilogram over 3,600 all squared. This is the first Monstellar equation. And this is the equation that suits our calculation because all of our parameters are given to us in kilograms and also in centimeters. So the height is in centimeter. So if this height is in centimeter, so that means we are going to have 90 multiplied by the weight is 20, right, over 3,600 all squared. So this will give us what? This will give us 1,800. Here we have 1,800 over 3,600. So all squared. So we have this. 1,800, that is 90 multiplied by 20. 90 is the height, weight is 20 over the denominator, which is 3,600 from the first molecular equation. If you do it, you have 1,800 divided by 3,600 all squared. Now let's continue from here. So the body surface area now will be 180 divided by this will give us 0.5. To give us 0.5. So the body surface area will be the square root of 0.5 is going to give us 0.7. Of course, it's going to be in meter square. So this will now serve as our body surface area. So we have calculated the body surface area for a child whose weight is 20 kg and height is 90 centimeters. So this is the body surface area. Using the first Monstella equation that says height in centimeter multiplied by weight in kilogram over 3,600 all squared. Now if you input all the data, all the figures, you arrive at 1,800 over 3,600 still in square, all squared. Then if you do the division, you arrive at 0.5. Now square root of 0.5 will give you 0.7 meter square. So that means our body surface area is now 0.7. So let's take that here. Let's put that here. Our body surface area, our BSC is now 0.7 meters squared. So let's take off these ones. Let's take off this. So now let's come back to the prescription. Let's come back to the dose. The drug was dosed like that. Is cyclophosphamide was dosed like this, 400 milligrams per meter square per day. So now, since we have obtained our body surface area, it will be easier for us to calculate the dose per day. So dose per day will be like this. Dose per day for cyclophosphamide will now be dose per meter square. What dose per meter square is 400. Dose per meter square is 400. Now, what is our body surface area? We got 0.7. So we got 0.7. So this automatically gives us, is going to give us 571 milligrams per day. So this will give us 571 milligrams per day. So this is what I'm going to administer. This is the dose of cyclophosphamide I'm going to administer for this patient per day. So I believe it's straightforward and much easier, right? So all you need to do is practice more and you will become an expert in calculating drug dose that involves body surface area. So it's not more than this. So I'm going to give you some examples and some exercise, or rather, I'll give you some exercises that you're going to go through, and you can also send your answers in the comment section for me to assess and also score you. So now let's take this. Let's take an example exercise. Let's take some exercise. Now let's take some exercise. Now let's say let me correct this at gmail.com. So let's take an exercise. Now you should calculate the dose of this drug, methotrexate. Methotrexate was ordered at dose of 20 milligrams per meter square per week. Okay, let's say per day. Let's say per day. Now, methotrexate was ordered at this dose, 20 milligrams per meter square per day. So calculate the dose that you are going to administer to a child whose weight is let's say 10, whose weight is 10 kilograms, and height is 70 centimeters. So this is the information you will need to calculate the dose of methotrexate you administer to this child, whose weight is 10 kilograms and height is 70 rather. The height is 70 centimeter, and the drug was ordered. This is the order at 20 milligram per meter square per day for the drug methotrexate. It's also an anti-cancer drug. So you can send your answer in the comment section, and for us to assess and also score you. Also, you can also contact us or reach us on the phone number. Can be on using call, or you can contact us even on WhatsApp. So it's a WhatsApp number. You can reach us also on WhatsApp, and also you can also reach us on the email you can see on the board. Of course, for partnership, for private lectures, we are open for all of that. So for questions also, you can please send your questions on the comment section. I'm going to attempt all of the questions. Thank you very much.